Lara has been building community in Monroe, Wisconsin, the cheese capital of Wisconsin, where I will be on Wednesday eating an ungodly amount of cheese. But she is now turning her sights onto a different community, and that is the physician community, to inspire a new era of creativity in that community. So please welcome a local Dr. Lara Salyer.
Thank you guys. My name is Lara Salyer, and yes, if you go past the IKEA, past the Cheddar Curtain, I'm from Monroe, Wisconsin, and we are known for our cheese. And tonight I'm going to share with you two things. I'm going to teach you why creativity matters. And the second thing is I'm going to show you how to prescribe creativity in yourself and in your patients. But first, I have a challenge. We're going to meet our neighbors again, but this time just for 30 seconds. I want you to pick a neighbor and fill in the blank of this statement. I do my most productive, intellectual, focused work when blank. You have 30 seconds. Go. Okay, great. I hear a lot of morning. I hear a lot of evening. I hear some crowded bookstores and a big cup of coffee. I heard some solitude and silence. So how many of us are early birds? Raise your hands. Excellent. How many of us are night owls? Pretty divided, and that's pretty typical. Now, no two brains are alike, thank God. But most of us can say that we're either an early bird or a night owl. And that's because our most focused work is when we use our prefrontal cortex. And that's when we make those executive decisions, and we're really thinking. Now, what's interesting though is if you want to do your most creative work, or your most creative problem solving, you want to try doing this on the opposite hours. Because that's when our prefrontal cortex is tired, and it allows our default network to come alive. We get to pull some ideas that we may not have thought of, some discrete criteria that maybe produce that aha moment. And that's actually gamma brainwaves. So next time you have that aha, thank your gamma brainwaves, they're lateralizing. So why are we so concerned about creativity? In a business standpoint, we talk about innovation and productivity, yada yada. But really on a personal, individual level, it makes you happier. Studies show that adults that nurture their creativity are more resilient, they're more successful, and they're more innovative. So creativity is really human, and it is exactly what James was talking about. It gives us purpose, just like the New Vision Health Tour. And I would like to say, I would bet my daughter's slime collection on this statement, that I think our healing profession is the most creative profession. Way beyond graphic design, way beyond medical illustration, or even acting. Now, why is that? Because we use all five senses, right? We're in the room, we're taking in context, we're looking at body language, we're feeling the energy, and we're using the right and left brain hemispheres. We're pulling together that patient's story, and we're knitting a tapestry of past, present, and future. And then we expand our divergent thoughts, and we're coming up with differentials and plans. All the while, no matter where you're at, you're creating a healing environment, a safe space. So I can bet that no matter where you are in this room, no matter what your journey is, be it nurse, chiropractor, doctor, all of us, when we were going to apply to the school of choice, how much you want to bet all of us were really honing that well-rounded creativity, right? We were taught to, become leaders and be in the community and polish your hobbies, and we all did this, and we got in. But the minute you get in and you sit down in your first lecture, it's like game over, right? That faucet, it's gone. But we expected it, right? We signed up for this. I mean, we're gonna go test and we memorize and we jump through hoops, right? It'll get better in residency, right? So then you're sleep deprived. And then you're cinching your scrubs not as tight as you were because you're really not exercising. And you're grabbing that day-old egg salad sandwich from the cafeteria and you just move on, right? Because it'll get better in practice, right? Right? But then you have RVUs, and you have insurance metrics, and you have algorithms, and you have checklists. And then suddenly you realize that you haven't been fueling that creativity because you weren't given that structure, right? And so we're facing this existential crisis in our healing profession, where we signed up for a career that was innovative and creative, and now we're in a different landscape. We've lost our purpose. But see, the secret's out, right? So ACGME, which is the governing body of our residencies, has issued a mandate just last year, 2017, asking all residencies to mitigate and address physician burnout, which is a wonderful thing. It's a good start. But there's no structure behind that, right? You go to a burnout conference, I don't know if anybody's ever gone to one, they're great. They tell you how horrible it is, right? But there's really no structure in place to deal with that, and it's already too far gone. And so now, even outside our profession, people are seeing our doctors retire early, committing suicide, sadly, and becoming more clinically depressed than the average population. A third of medical students are clinically depressed. Okay? And so I'm not ready to call time of death on our profession. I really love the healing profession. And I believe that what we need to do is to talk more about creativity. See, creativity is actually a brain activation pattern that can be amplified through conscious effort and a bit of practice. Okay? And see, words are a funny thing though. I don't know if any of you would raise your hand and say you're creative. And if you are, raise your hand. Anybody creative in here? Rock on. I'll tell you in a second, we're all creative because the bar is set really low, okay? But see, words are a funny thing because to self-identify, I didn't even self-identify as an adult until I bought a carton of eggs and kept it in my fridge, right? I don't even identify as a mom on most days because I feel like a referee. So to tell your patient or yourself, are you creative? Sometimes you feel like that's such a high bar, right? But it's not. The definition of creativity is something new and novel, and useful. That's it. And our most creative minds already know this. So we have the newness in the individual psyche is an endlessly varied recombination of age-old components, Carl Jung. And T.S. Eliot, a good poet, will usually borrow from authors remote in time. But my favorite is Pablo Picasso, which is good artist copy and great artist steal, also said by Steve Jobs. And that's to a point though, right? Okay? There's a limit on the copying. But let's travel back a little bit after Milli Vanilli, 1991, right? That's the year of Doc Martens and Furbies and fanny packs. You know, everybody's smelling like Teen Spirit, right? And my own creativity was basically just how to tie the flannel around my waist that didn't inhibit my dancing. That was about it. But see, at that point, Dr. Jeffrey Bland was looking and using his creativity to look at the chronic disease burden in our system and seeing that the acute care model was no longer going to work. So what did he do? He took the way that we look at patients and diagnoses, and he plotted it on a matrix, and he taught us how to dig deeper and look at root cause. Now, fast forward to 2018. Thank God there's no fanny packs. There's still flannel, but now we have James Maskell using his creativity to look at our healthcare system, and he pairs a worldwide network of functional providers with an army of health coaches to make it more accessible for everybody in the US. Okay, so now you understand why creativity matters, and my favorite part is I want to teach you how to nourish your own creativity today. So we know that creativity is a brain activation pattern, right? And we know in functional medicine that nutrition directly influences your energy and your mitochondria and your neuroplasticity. So if you combine this with over 400 clinical references and an online gamified approach, you have Right Brain Rescue, which is the world's first creativity incubator. And basically, I spent months distilling down the keystone habits of the creative minds, and I want to share with you the foundational method that I teach today, so you can start using this right away. The method is based on a mnemonic, MIND, which stands for mitochondria, integrate, notice, and divergent. So let's start with mitochondria, right? We know that the brain weighs 3 pounds, which is like the size of a toddler diaper. And yet it's responsible for 25% of our ATP, right? Okay, we need 25% of ATP to go right to the brain. So when you leverage your energy by putting things in your body like L-carnitine, acetyl-CoA, coenzyme Q10, flavonoids, all that stuff, that can be the difference between a sleep-deprived, burned-out resident with brain fog and cognitive difficulty to a resident who might still be sleep-deprived but knows exactly how to fuel their body. I integrate. That is the crosstalk between our right and left hemispheres through that corpus callosum. You can encourage that by priming it with cross-body activities. That's the basis of EMDR, if anybody's familiar with that. But 2 examples of cross-body activities are walking and running. And some of our greatest minds, like Georgia O'Keeffe and Henry David Thoreau, talked about the creative insight they would get just walking out in nature. So anytime you have a problem, anytime you're struggling, take a walk. It allows that default network to come forward. And is notice, that's the convergent thought process, right? The noticing your internal environment, noticing your external environment. When you practice this and you take time out every day, you'll hone that cognitive flexibility. And then lastly, divergent. That's the expansive thoughts that we are typically thinking of for a creative mind. But see, it takes all these parts in place. And a familiar divergent task would be to take an object like a brick and then come up with as many different functions to use for it. It gets those neurons pushed and grows that neuroplasticity. So now you know why creativity matters. You know a method to start nurturing it. But I think my final comment might raise some hairs here. It's a little rebellious. I don't think functional medicine is the answer to everything. I don't think there's a root cause to our healthcare crisis. But I do believe that what we pay attention to will grow in power. So if we water the seeds of creativity, I do believe that all of us can come up with a solution for our healthcare crisis. Look what we did in 2001 when we focused on pain as a vital sign. And now, decades later, we've got an opioid crisis. So my invitation to you, for 10 years from now, would be to start focusing on creativity every day. Set an intention that you can do this with one question. You can ask yourself or ask your patient, when was the last time you did something creative? Just start the conversation. But if creative is a sticky word for you, replace it with fun or joyful or self-serving. And maybe, just in 10 years, just like Dr. Jeffrey Bland, just like Mr. James Maskell, you will be a part of the revolution. Thank you.
Great job. Thank you, Lara.